This is Tom Lee, Editor-in-Chief of NEJM Catalyst, and we're talking today with Dr. Brian Donnelly, an orthopedic surgeon who is the CEO of Cleveland Clinic London, the 185-bed hospital that will open sometime either late in 2021 or possibly early 2022, right near Buckingham Palace. We're going to talk a little bit about the hospital itself and its potential impact on healthcare in the UK. But that's because our real topic today is creating or changing a culture. This is a topic that's relevant when organizations merge, or when single organizations that might have existed for centuries try to change their performance or adapt to our wild times. Brian has the advantages and the disadvantages of starting an organization from scratch, but he's also an outsider in the country where he's working. So we scheduled this conversation with the theory that the lessons he has been learning might be useful to leaders in healthcare in many other contexts. So Brian, the fact is we can't really have the culture conversation without our listeners knowing a bit about Cleveland Clinic London. Can you give us a high-level description of this enormous initiative?
Yeah, sure, Tom, and thanks for having me. I think at the Cleveland Clinic, we've been proud of the success we've had for nearly 100 years, but we realize we want to continue to be great and have great success for another 100 years. What's been important to us is a culture of continuous learning and a passion around innovation. And so that really is what fuels this move to London. As you said, it's a nearly 185-bed hospital in central London, 29 ICU beds. We're here because we want to combine the best of Cleveland Clinic with the best of UK healthcare, bring that together to make the Cleveland Clinic London model. And then with what we learn and what we innovate in London, we can spread back across our organization globally.
Well, so the big picture is, how is it going? It's a big deal to build a hospital in any setting. You're doing something even more ambitious than that. And you're doing it in the middle of a pandemic. So how is the work going?
So it's going well. We've had great receptivity to our model. The medical community's embraced us very well. There's been a lot of interest and a lot of ability for us to work with leading institutions in the world, leading universities here, leading healthcare systems. And so that's worked well. There certainly is a lot of execution work to do. The pandemic has made it a little more challenging, but it's also presented a lot of opportunities for us.
Well, now, I know enough about your story. You went to Cleveland Clinic in 1996, and you worked in a variety of places around Cleveland as the Cleveland Clinic footprint enlarged. The clinic went to the Middle East, and I'm sure you visited there. And now you're living and working in London. My guess is that in all of these contexts, within Cleveland, now in London, some of your new colleagues have seen you as an invader. So what are the basic principles that you've learned for how do you get started?
Yeah, that's such a good question, Tom, because, it's really, I think, in the forefront when you come to a new country that you're clearly different. But in many ways, as I go back through all the different steps of leadership I've had across Cleveland Clinic, each time it's been like that. Whether it was a new hospital in Cleveland, a new area, you're coming into something new. And so as we come into London, it's really a lot of the same principles as you start out into something new. And I go back to the importance of humility. You also have to have patience. Things won't work as fast as you want them to work. And I think also, like, in your heart, you have to have a burning curiosity and a burning passion to learn. And as we have that, and we put that across our team here in London, it allows us to come in with an open mind to really look at the wonderful opportunities we have to continue to learn here and help integrate what we have in Cleveland. I think probably humility is one of the most important aspects for any leader, but clearly trying to start a new health system in a new country that has established good health care.
Well, and that point was one of the major reasons why I wanted to have this conversation, because I think that, you had to learn that for sure going to another country. But my guess is a lot of our colleagues could benefit from keeping that in mind when they're just going cross town. And now at the same time, you do have to be assertive about what you're trying to do. And I've heard Toby Cosgrove talking about exporting Cleveland Clinic DNA. Business as usual, as in the new country or in the other hospital, that's really not the goal. So how have you approached that? It's got to be a little different.
I think that's a really important point, Tom, because humility doesn't mean being passive. You do have to be very assertive, and to do that, you have to be completely confident on what your core success is. And so coming in to London, it's critical that we clearly understand what is our core success and that will not change in our model, whereas other things around the model we can change. What we do here to make sure we understand our core and we work on simplicity, so we have simplicity of message, is we have one slide that defines what our purpose is, who we do it for, what our priorities are, and then everything is based off our values. So at the Cleveland Clinic, our values are quality and safety, empathy, teamwork, integrity, inclusion, and innovation, and we constantly discuss those. The 9 words that describe Cleveland Clinic London, so anyone who joins our team, what we say is, you're not here to build a hospital. That's actually not our purpose. The 9 words that describe our purpose are compassionate caregivers transforming health and care for the world. And that's what this building, Cleveland Clinic London, is for.
Well, that secret sauce that you described, starting with humility and then having confidence and clarity on what your values really are, and then being flexible and able to learn, that does seem like a great recipe. And it was a major reason why I wanted to ask you to speak to our listeners. But my assumption has been that no one was expecting to have to be as resilient as you've had to be, and everyone in healthcare has had to be as the COVID pandemic has rolled out. So no conversation is complete these days without asking, how has COVID affected you? How has it thrown your work for a loop? And how have you dealt with it?
Yeah, we've certainly been affected like everyone around the world. Probably the 2 big effects for us have been construction. So construction had to be stopped for about 5 weeks in the pandemic as we prioritized the safety of our construction workers. We had to fabricate the construction site and reorganize it to make it safe for all of our construction workers. That's decreased the total number we can get on site. So that's been a concern for us and been a delay around construction. I think the other effect has been the fact that on a Monday, on March 9th, we came into work expecting that we'd be working for several more months. And by that Friday, we went fully remote and closed the office down. And actually since then have had the office closed with only a small number of people coming back into the office. And so those have been 2 big things for us. But going fully remote would have seemed concerning and worrisome to me in February. It's actually been a wonderful blessing in many ways. And we've learned so much. We've innovated how we've communicated. And we've had great progress in our work and continue to hold people accountable. And the one great learning I'll tell you we've learned is that empathetic communication is always important. When you go fully remote as a workforce, it's more important than ever. And so we constantly are working off the principles of delivering realistic optimism, delivering hope, but determination and inspiration in all of our messaging as we're not face-to-face anymore. And now we're starting to come back in the office. And so we're even stronger than we were when we left the office.
Well, I'm sure there are going to be a lot more unexpected bumps in the road between here and there. Now, one thing I have learned over the years that's helpful during times of turmoil is to pretend you're out in the future. Pretend you're 6 months out past the pandemic. Pretend you're 5 years out from the starting of Cleveland Clinic London, and look back and imagine yourself looking back. And that is both helpful and it keeps you calm, but it also gives you clarity on what you're trying to accomplish. So let's close by giving you a chance to describe what you're hoping people are going to say about Cleveland Clinic London at, say, the end of the decade.
I hope there's a couple things people say about Cleveland Clinic London in the end of the decade. One is we look to bring the best of Cleveland Clinic and integrate the best of UK healthcare. I hope people will see and be able to say that this brought the teachings, the learnings, and all the years and years of experiences of wonderful clinicians, wonderful hospital leaders together in two countries to form a model that's never been before. And that's one thing I certainly hope. But probably more important than anything, Tom, I hope that there's families here throughout the UK who might not even know us. They might not even come to Cleveland Clinic London, but Cleveland Clinic London will have had an impact across healthcare across the country, and that they'll say, that my mother is alive, and my mother was able to experience my wedding because of something or some new protocol, some new pathway that came to their hospital because they learned it from this integration that occurred at Cleveland Clinic London. And that's where I think all of us, we all look for meaning and purpose in our work. And that's the meaning and purpose we want out of Cleveland Clinic London, that not just that we've impacted the patients that come to Cleveland Clinic London, but that we've impacted over 60 million people in the UK and beyond.
Well, those are terrific aspirations, and when there are difficult moments ahead, I hope you'll sometimes come back to the last paragraph of this interview, and it'll help you stay on course. We will keep on checking on how you're going, and I'm sure you're going to learn more lessons, and we look forward to you sharing them with a lot of other people in healthcare, Brian. So good luck to you, and thanks so much for doing this work and doing this interview.
Thank you, Tom, for the opportunity.